everybody, and welcome back to the pre-admission game. Mitch and Aharon tuning in for a discussion of interview ethics in medicine. How are you doing this afternoon, Mitch?
I'm doing fantastically.
Same as ever.
I'm always really good, thanks, Aharon. So guys, today we are going to be talking about ethics and as they apply to you in your medical interview preparation. So
and hopefully medical career.
Absolutely.
If you're an ethical practitioner, if that's the path you choose to go down.
And by law, you will have to be an ethical practitioner. So it goes without saying that this education, is going to be formative for you not only in your pre-medical school life, but also as you become a doctor.
The thought of me providing formative education. Anyway, well, let's get down to business. So I guess the first order of the day is for us to have a bit of a chat about, what are medical ethics? Well, let's put it this way. What is the use of medical ethics? So, isn't medicine just a job? You walk in, you assess patients, you give them the right medicine. Mitch, from your clinical experience, have you encountered many ethically challenging situations in the hospital? And if so, what were they like?
Absolutely. I mean, I think the bottom line is that as a doctor and even as a medical student, you encounter ethical situations on a daily basis. I think there isn't many interactions that you can have with patients where there isn't some form of ethics involved, whether that be navigating power dynamics, talking to patients who are from, diverse backgrounds that may be more or less advantaged, and just recognizing little biases that you have, generally that could affect the way you practice. That's just, little cognitive things, but also, there are massive, structural things. Who has access to surgeries at given times? There are triage systems when you go to the emergency department. That's probably why if you've ever gone to the emergency department for, a cough or a cold or something, you probably waited for, 8-9 hours, and they probably told you, go home and see your GP tomorrow. So there are so many ethical scenarios in hospitals and in medical practice generally. I think, you are going to have to deal with them whether you like it or not. And you need to have an understanding of where these things come from. And, for you as pre-admission, students or pre-medical students, you need to be able to demonstrate to the examiner that you are not only ethical, but also that you have, rational approaches to problems. And that's really what you're trying to demonstrate in the interview.
Absolutely, absolutely. I think my favorite, I shouldn't say favorite, most memorable, I guess, even though it's really not something that we should be happy about, situation in the hospital is that in Melbourne, Australia, we certainly get a lot of overseas patients for lots of different reasons, and many of them aren't native carriers English language. That sounded weird. They're not native speakers. Especially as you sort of get older and you maybe interact with the wider community a bit less, and you spend more time with your family. If your sort of first language isn't English, and sometimes you have difficulty communicating in a medical setting, and there's of course a shortage of translators. Not enough translators to translate for everybody, and you get stuck in these dilemmas on the wards where you need to communicate some urgent care to the patient, and you have to balance between waiting for a translator or perhaps try to communicate with them yourself and risking being misunderstood.
Absolutely.
So like Mitch was saying, very complicated power dynamics that aren't trivial at all. If we're trying to create blanket rules for good behavior and behavior that supports patients, ethics is very, very important.
And just, when you've made lots of ethical decisions at the end of the day, how do you go home each night knowing that you've made, the right decision? And I think, if you have a sound ethical framework to draw from in your practice, you will at least be able to say, this is what I was thinking, this is why I was thinking it, and these were the actions that I took. And I think if you have, that toolbox to draw from, it'll serve you really well in, preventing burnout and, just making sure that you're able to sort of, cope with the emotional demands of working as a doctor as well. So it's really important. I suppose Aharon and I are just trying to sell to you that it's not purely academic. It's important and it's practical.
And it's going to help you get into medicine because you need it for your interview
anyway. That's right. So without further ado, we want to introduce these sort of medical, 4 medical pillars, I suppose you could say, 4 ethical pillars of medical ethics, I suppose you could say.
The ethical pillars of ethics.
Yes, indeed. Yeah. So we have these 4 pillars, and I think they were originally put forward by some, old, long deceased person called Hippocrates. If you want to do a history lesson, look him up. He's a good chap. Some call him the father of medicine. Mitch calls him a good chap.
He's on a first name basis. I can't verify any of this history, by the way, guys. So I'm going to leave it. That's completely.
I'll be the medical historian.
Yeah. We'll print a redaction later. That turns out to be completely untrue. Yeah. So what are these 4 ethics?
Yeah, great. So we've got autonomy first, and we'll go into these in more detail, obviously,
in a second. Yeah.
But just to rattle off the 4 pillars of medical ethics, we've got autonomy, beneficence, non-maleficence, and justice.
Absolutely. So I'll start with autonomy. I'll have a chat about it because I think it's my absolute favorite, and the one that is certainly underpinning my motivation to practice medicine, and then we'll sort of bounce back and forth between the others. And towards the end of this interview, we'll also do a bit of an ethics case discussion, an MMI type question, where we'll show you how these fit into actually, I guess, acing your MMI, doing well, impressing your examiners, impressing the admissions committee. Good. So regarding autonomy, I think autonomy, starting at the very beginning, the word means independence, the capacity to make your own decisions independent of anybody else's influence. And it seems fairly, straightforward on the surface. At the end of the day, all of us wake up in the morning, we choose what we have for breakfast, we choose to go to school, to university, we make our own decisions. But that's a very superficial way of looking at it, because from a patient's perspective in the hospital, if you get sick, you don't really know what's going on with you. You don't know where the pain is coming from, you don't know what the implications of the pain are, and you land in a hospital bed where the doctor essentially has all the power. They have all the knowledge, they have the options laid out in front of them, what procedures you should undertake, what medications are available, what the consequences of that are. Is this procedure going to leave you with a scar maybe? Yeah. Is it going to be a bit of an unpleasant tasting medication? And for them it's routine, but for you it's completely unknown. So despite the fact that you're at the center of the experience, you really don't have any power over how your life moves forward from that point. I guess you can say, yes, I want to be treated. No, I don't want to be treated. But, it's not a matter of, I want to leave the hospital now. That is not really an option for you.
Not if you want to receive treatment, I suppose.
Not if you want to receive treatment, not if you want to be well.
Yeah.
And Mitch talked about power dynamics earlier. So can you tell us a little bit about how power dynamics play into autonomy?
Yeah, well, I suppose, as Aaron said, you choose when you want to wake up. Go about your normal day. I know in the COVID era, autonomy is something that has been eroded, taken away by the government a lot in terms of us wanting to go to Europe on holidays or to Sydney even now. But this idea of autonomy is that you get to decide what you're doing. Now, if you go into a hospital, as Aaron said, you lose a lot of that autonomy. So people have say over when you eat dinner, where you are receiving care, and you don't have much choice over which clinicians are going to be responsible for treating you in a public setting. So, you don't have a great deal of autonomy, and that's, in people who are considered, mentally capable, they have capacity. People who don't have capacity have even less autonomy, and people who are in mental institutions.
Or even just feeling unwell, maybe a little bit delirious in a hospital.
Yeah, absolutely. Right. So you lose a lot of that autonomy. Now, so there's this idea that, going back to power dynamics, you're in a hospital and you don't have all of your autonomy. You've lost a lot of power, in a sense. And so, and as doctors and, other healthcare professionals, they're very aware that this dynamic exists. So autonomy is this idea where we're trying to make an overt effort to return power to the patient, because the patient's already lost all of these things by being in the hospital environment and assuming that patient role. But really, everyone has a right to as much autonomy as possible. So really, what we're trying to do by thinking about this ethical principle is maximize the patient's autonomy where we can.
Absolutely. And this idea is actually relatively, the concept of autonomy is obviously not new, but the emphasis on autonomy in medicine is very new, because we've come from, a historical paradigm in Western medicine where the doctor's job is to fix the patient. You go in, doctor goes, blah, 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 take this medication, you leave, right? But at the end of the day, you got to ask yourself, why do you even want to be in medicine? Well, you want to be in medicine because it it helps you give other people their life back, right? Mm-hmm. It's not just because, yes, the science is satisfying. Yes, you want to solve complicated problems, but this isn't a Lego set that you're building. This is another human being. And at the end of the day, the thing that I wish for certainly the most is that the patient leaves the hospital, never comes back because they never have to, obviously because they're doing alive, because they're alive and well, and they've got their autonomy back, right? They've got their freedom to live their life as they choose back. And from that perspective, right, your job is to bring them up to speed as a doctor. Your job is not to administer a treatment, right, although that is part of it. It's also about saying, okay, look, Steve and Jenny, blah, 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 this is your situation. This is what you need to know. Break it down for them. These are your options as far as I see them, right? I've read these papers on your behalf, so, to help you, and these are the risks that we know about as a medical community. Now you have the information. Now you have the power to make a decision.
Yeah, absolutely.
Right? That's really the biggest part of medical ethics, I think, today. That idea that you're not taking control over somebody's healthcare, but you're empowering them to make decisions that you then, as a skilled medical practitioner, can put into practice.
And it demonstrates a lot of skill as well if you can really involve the patient in the decision-making process. So I suppose that is autonomy in a nutshell. We're trying to just maximize this person's ability to be a human, which is to have autonomy, and these are real core, fundamental rights of people, right? So we're just trying to think about that, and we want you to have that in the forefront of your mind when you're approaching medical ethical scenarios.
I guess the last thing that I would just add before I think Mitch will take over on the topic of beneficence is that just because you paid an inordinate amount of money for a medical degree, and because you've gone through medical training, doesn't in any way, shape, or form give you the right to decide on another person's behalf what is good for them, right? Your intelligence is a gift for you to use. It's not a lever of power for you to pull, if that makes sense. So something to keep in the back of your head when we discuss autonomy. But I think enough of that. Mitch, can you tell us a little bit about beneficence?
Yeah, so beneficence, I suppose you've probably been thinking, to those of you who have heard of these ethical pillars before, beneficence and non-maleficence can be sort of seen as two sides of a similar coin. But I think the best way to think about it is to go with non-maleficence first. And I think that the reason for that is, going back to Hippocrates, he was the one who said, "First, do no harm." And I suppose that means that it should come first in some ways. So we've got this idea of, at the very least, don't do harm to this person, and where that comes into ethics in many ways is that in order to derive benefit for patients, in order for them to get benefit from whatever you're doing, you often have to harm them in some ways. I mean, you could think about someone being in a hospital, like in a big box. What's that doing for their overall mental well-being? We deny them from seeing their relatives aside from a few times, throughout the day. They can't work. They can't really do what they want to be doing in many ways. So, these things harm people. We also subject them to surgical procedures, which, involves cutting and, taking off pieces of people's bodies. So really, we are doing harm to patients. We need to think about what is the net, benefit or loss in the situations. And I think in many ways, or hopefully with everything that we're doing now, the beneficence or the doing good outweighs the harms that are given to them. So if you think about beneficence, think about it in terms of beneficence versus non-maleficence, because you will often have to do harm to a person for them to have long-lasting benefit. So you really need to be thinking, what on net is better for this person? And that's where autonomy comes in, because going back there, I know we've already discussed autonomy, but what is best for a person is up to the individual. You might have to operate on, say, someone's. I can imagine you could be trying to operate on someone's voice box for some reason. But if singing is the most important thing to that person, and you accidentally damage their voice box, but cure something else that's important, that could be life limiting to this person eventually, but they're not able to spend their their remaining years singing, that actually might not be something that's worthwhile to that person. So really, I think when we come to these ethical scenarios, making sure that you have all of the information and really keeping the person at the center and trying to understand their autonomy and their values will determine whether or not on net you have done more harm than good.
It's a very interesting point, Mitch. I think it highlights this idea that, living is not always more important than being alive, if that makes sense.
Absolutely.
Sometimes if you lose your lifestyle as a result of being, and I mean, the most extreme cases of that are people who spend years on life support. You wonder, well, what sort of quality of life is this actually worth it? But I think the example that comes to my mind, just coming off a urological surgical rotation about non-maleficence is, for example, one of these procedures that we do in urology is you need to look into the bladder, and the way you do that, and everybody who's a bit squeamish, close your ears, is you put a very small camera down the urethra. It feels weird discussing these medical terms. It's a very, very safe procedure.
Through the water passage.
Yeah, through the water passage, exactly. It's a very safe procedure, very, very common, but a little bit uncomfortable. Right? And there are circumstances where you would want to maybe give somebody a little bit of sedation, put them to sleep when that happens, right? Or alternatively, you can just give them a little bit of anesthetic and they're awake, and that happens when they're anesthetized. And that's a bit of a dilemma, right? Because you want to make them as comfortable as possible, and you don't want to give them any anxiety, psychological distress, physical pain. But at the same time, there's the more chemicals you inject into their body, that changes the risk profile of the situation. So you have to be asking yourself, well, is it beneficial for us to do this procedure, right? Given the fact that we want to avoid harming this patient at all costs. If you think, there's an argument, maybe everybody should get, I don't know, a scope to look at their bladder, just to see if their bladder is okay. Everybody in Australia. Let's say that this procedure has a 1% risk of causing you some harm, right? Is it worth it subjecting a large population to this procedure on the odd chance that you might find some cancers, given that 1% of the patients, it's a fairly small number, but if you have a big population, 1% of the patients might end up with a complication as a result of this procedure. So like Mitch was saying, balancing the good that a procedure is doing with the fact that you want to avoid harming the patient at all costs.
Yeah, is it better to vaccinate everyone with a vaccine that you currently have, knowing full well that 1 in 100,000 people may have an issue? We've seen 2 people die on a daily basis in New South Wales. These are the types of ethical questions that obviously now policymakers are becoming involved with, but also healthcare workers have to deal with on a daily basis. And it's really hard to weigh these things up. So
of course what Mitch is talking about here is the sort of the back and forth of the health ministers on the AstraZeneca vaccine, which, by the way, we should probably we strongly support vaccination.
Yeah,
we don't cast doubts in anybody's mind. I think we're just sort of trying to rationalize that the decision isn't just about, it's not just a political football. It's this very complicated and difficult bouncing back and forth between, if we're living in a zero COVID environment in Australia, right? Of course, imminent danger of COVID, but zero COVID perhaps at some point last year when we had no cases, right? Is it ethical to, administer the vaccine in younger people where the vaccine has this tiny risk, but, we're living in a zero COVID environment. So, do we want to prevent the COVID wave or, so it was very, very complicated. Needless to say,
Absolutely.
I think you and I both got vaccinated, of course.
Yes,
right?
yes, of course.
Really
So those of you
for us.
listening at home in the year 2021, go get vaccinated.
Absolutely, absolutely.
We've now discussed beneficence and non-maleficence. So bringing it back, the beneficence is just doing good, and non-maleficence is not doing bad, so not doing harm. And these things, as you probably understand, are sort of considered together. All of these ethical pillars in many ways are considered together because they're all involved. But these two in particular, because they're 2 sides to the same coin. Now, the last one is justice. Justice is something that we see, we have a whole legal system which is all, based off justice. So those of you who are from a law background or something like that will be well akin to this. Justice is mainly about fairness. So you have to think, what is fairness? Well, fairness is equity or equality. And these are 2 things that seem very similar. Often people use them interchangeably, but they're
Really not.
But they're not exactly, the same. Aaron, would you be able to talk about equity?
Absolutely. I think if we're talking about equity and equality, the graphic that comes to mind, and I'm sure some of us have Googled this, and it's on our website, I believe, in the article where we discuss this, is it's three people, and they're sort of trying to look over a fence to see a sporting event, right? And they're all of different heights, right? And equity is when you put a platform under each of the persons such that the outcome is the same. They're all looking at the event at a different height, right? Whereas equality is where everybody gets the same boost at the start, right? But you don't necessarily end up with the same outcome, right? So it's sort of the difference between a blanket assistance across the board and assistance that is proportional to your situation. And while it may seem that one is unambiguously better than the other, it's really situational. Sometimes you want to aim for equity, sometimes you want to aim for equality. It's as is with the case with all of these ethical values. Yeah. It's very, very contextual. You have to take it on a case-by-case basis.
Absolutely. And I think that the example that comes to mind for me is thinking about the funding system for the Australian education system. So those of you who have just finished high school, now in university, you might be aware that independent schools, so the big private schools who take huge fees from their students and have immense resources, also get quite a lot of money from the government, which they spend on things like fireworks and new auditoriums and things like that, and that's all very well and good. That money could also, one could think, could also be spent on a public state school, that doesn't receive huge amounts of fees from the paying students, and it's a matter of thinking, well, should the government be giving huge amounts of money to these schools? On the one hand, people choose to pay money to the school, and so they should just have more resources because people have chosen to spend their hard-earned money on that form of education. But on the other hand, should more money be given to help people who are less advantaged, who can't afford these big, expensive private schools? And these are the sort of, it depends on your view. Certainly, it seems the Australian government's view is equality.
Well, that's
is
exactly
the most,
it, right? It's equality. So there's a position that says, okay, it's unfair if you have a school that has, kids there that live in Australia, right? These kids are local residents, they're entitled to an education, so it would be unfair that one school got government support and one didn't, and that's one side of the argument.
Absolutely.
But the other side of the argument is, well, you would argue that a school that doesn't, have, parents paying 20, 30K a year, right, in order to be, competitive and up to a national and international standards, requires more government funding than, your odd private school that has sufficient is a judgment statement. It has a large quantity of money that is already coming from the people who are paying it to school their children. So that would be an equity approach perspective. And again, very, very important to reiterate, especially going into a career, a medical career, where you have to respect your patient's opinions, respect the opinions of other team members, which would be very diverse and different to yourself, that almost always there is merit to each side of the argument, right? And perhaps you could have a very strong opinion yourself, but certainly in the interview, it's very important to emphasize that there is merit in every side of the argument, because at the end of the day, they're looking for somebody who is a proficient negotiator, right? If you want to achieve your aim of getting the best care possible for your patient, right, it's important that you respect all your team members rather than you come in and say, hey, it's my way or the highway. I am the absolute moral good here, and you just try and just try and overcome the hurdles in your way all by yourself without bringing in your team members and trying to find a sort of balanced ethical solution that respects everybody's view, regardless of whether you agree with it or not.
Yeah, and I suppose what you've touched on there is a really good point, that yes, the ethics station in medical interviews is talking about is addressing your understanding of ethics and trying to see where your judgment lies, but also they're trying to see, are you someone who's able to take a considered approach to problems, and are you someone who's going to be able to work with other people, because often you need to see things from other perspectives, which is really important for communication and fostering a positive team environment, right? So although it's just about, yes, it is about ethics, what is being tested is more than that, right? It's your communication skills, it's your negotiating skills, and it's your ability to understand other people's perspectives and not to be so, inflexible in your own opinion that you can't, humor these ideas, because you'll find patients, as Aaron said, that have completely different worldviews to you. And you still need to find some common ground where you can foster a therapeutic relationship. And the same goes for your colleagues as well. If you want to work well with your colleagues, you need to find some mutual ground of understanding where you can come together and work together as a team.
Wonderful. Okay, so that was the 4 medical ethics in a quick 20-minute nutshell. I think what we want to do now is give you a little bit more of a practical example of exactly what we're talking about. And we're going to do that by discussing 2 ethics scenarios. We're not going to format this in the way we would format an MMI answer, in the sense we're not going to be time pressured. It's going to be a very casual discussion where we identify the values, which is maybe not something that you necessarily, you don't want to be so inorganic in your interview, but these are definitely the talking points that you want to condense into a good interview answer. So I'm going to describe the first scenario, Mitch, and then we'll go through autonomy, beneficence, non-maleficence, and justice as they apply to the situation.
Yeah, and I suppose just to flag, this is one framework that you can use in your approach. There are many ways to skin a cat, and you shouldn't be skinning cats; that would be unethical. But there are many ways to do it if you did decide to do it.
Undermining the cat's autonomy, justice. Yeah.
And so. What we wanted you to do is just to take broad brushstrokes from what we're saying, and just to think about the themes of what's being said, and to try and come to your own conclusion of how best to approach ethical scenarios.
That's exactly it, themes. Okay, so the first interview ethics question sounds like this. So I'll describe the scenario in a very casual, detailed way. So in this scenario, you are the manager of an apartment building, right? So you live in this apartment building and you manage all of the apartments. You're sort of like the residential, what would you call it? An RA?
A residential manager?
Yeah, residential manager.
A building manager?
Yeah, building manager. So, and in this situation, the tenants come to you with complaints should anything arise. Now, usually it's run-of-the-mill kind of stuff, that there's faulty electrical wiring in the ceiling, my fan's not working, door needs replacing, that sort of stuff. But today, this morning, one of the tenants knocks on your door and is quite angry, quite flustered, and they say that there's a new tenant in the apartment below them that has been making quite a significant amount of noise. And they would like you to do something about it. They're complaining, they're very upset, it's very disturbing. And in an ideal world, they'd like this tenant to be evicted. Right? They think it's inappropriate for this tenant to be making these loud, obscene noises at 2 a.m. in the morning, at a time when everybody's trying to sleep. The kids in the tenancy block are trying to sleep. It's really disturbing. And you respectfully say, okay, thank you very much. Thank you for letting me know. I will investigate it. And as you close the door and begin to reflect on your approach, you remember that this new tenant is actually someone that has a disability. Now, let's say that the question doesn't specify what this disability is, right? But you know that they have a assistant that help them negotiate the lease, and that's how you're sort of aware that this person has a disability. And I guess the question would ask you, well, what is your approach to navigating the situation? What do you do as the manager of this apartment block to resolve what is effectively a conflict, isn't it? Right? So why don't we start with autonomy and talk about how autonomy relates to this scenario. Mitch, what are your thoughts?
Look, I suppose, and I know these are medical concepts, but it does apply to real world situations. So we're talking about people's sort of rights to be able to do what they want. I mean, this person who has a right to complain first and foremost. They are allowed to come and talk about, voice their opinions of what they think is not appropriate. But also equally, this person that they're complaining about is in their own space. Now, they should be able to do what they want within the confines of their own apartment, with the caveat that they are in an apartment building. They have to be mindful of other residents. Now, we've got a complicated scenario now because we have someone who, as the building manager, we are aware, may have a disability or something like that. And so it might not be as straightforward as saying, hey, can you just keep it down?
Exactly. And I think the other thing to remember here is that while that possibly could be one outcome of the negotiation, right, that's a knee-jerk response, right? Because you immediately put yourself in the complaining tenant's shoes and you think, oh, it's inappropriate to be making noise, right? This needs to be stopped. I need to put my foot down. But as Mitch said, everybody has a right to do as they wish in their own space, given that it doesn't necessarily disturb your neighbors. And the other thing to remember here is that before you take any action, you have to respect the decision-making autonomy of the tenant making the noise, right? So the first step, I think, here would be to gather some information, right? So you don't know who this tenant is. You don't know what the reason is for them making the noise. You don't even know if they were truly the one making the noise, right?
Yeah.
That's the important, your knee-jerk reflex. Oh, this tenant is certainly making the noise. What if this guy is mishearing something? What if the noise came from outside? You're not going to react before you have the full set of information. So I think respecting autonomy, now that you've gotten the story from the complaining tenant, the next step is to get the full story from the tenant who was making the noise and to really understand the situation from both sides.
And I really like there how Aharon, didn't jump to any conclusions. He took a step back, and I think he tried to sort of, see what is actually happening here and appreciating everything objectively. Because, yes, as you said, there is this subjective, I suppose, knee-jerk reaction to these things, and you need to sort of say, no, naturally, being an interview and being an ethical station, there will be some complexity to the question. It's never going to be that simple as, oh, you would just do this. It's like, no. And I'm sure you're all aware of that. But you need to think of a way to have a structure. And by saying, okay, I would take a step back and I would consider these things and I would consider these things. And I think, by doing that, you're starting to set a framework for approaching the situation in a logical way that's going to demonstrate good